we hear so much about women suffering with premenstrual syndrome like PMS or painful periods. It's a common syndrome, but it's not normal.
The more modern cultures tend to suffer with PMS symptoms more strongly than cultures that are living closer to the earth or without as much processed food or without as much external stressors or influences.
Today I'm joined by Dr. Blossom, naturopathic doctor. She runs a successful practice outside of Moncton, New Brunswick. Today we're going to talk about all things mensy for women and as we transition from perimenopause, menopause, and postmenopause. Some great information here for you, and I hope that you take the moment to implement any of these suggestions that Dr. Blossom is recommending. So stay tuned as we dive into all things mensy. Hi, everyone. Welcome to Talk to Vicky, a total approach to wellness. I am joined today by Dr. Blossom, and I'm so excited to interview her and talk to her about all things women health. And Dr. Blossom has been practicing as a naturopathic doctor in the Moncton, New Brunswick area since 2003. In her practice, she helps families achieve a higher level of health through fostering and balancing between their bodies, minds, and spiritual health. Dr. Blossom is also a medical consultant with St. Francis Herb Farm, where she offers support for their professional accounts. St. Francis Herb Farm is an organic, family-owned grower and a producer of medical herbs. This year marks their fourth decade of growing plant medicine. During her spare time, Dr. Blossom loves riding her mountain bike, gardening, and exploring new places with her family, but mostly spending quality time in nature. So welcome, Dr. Blossom. Thank you for joining me today.
Thank you for having me.
Oh, absolutely. I am so excited to interview you and talk about all things women's health. I have all ages of women coming into my store, and you can imagine I hear all concerns and their struggles in regards to hormone health. So let's break it down from having a monthly menstrual cycle to perimenopause, menopause, and postmenopause. So we hear so much about women suffering with premenstrual syndrome like PMS or painful periods. So I like to say it's a common syndrome, but it's not normal. So Dr. Blossom, can you talk about what is going on there and why young women are suffering this way?
It's a very interesting question. I remember, decades ago when I was studying naturopathic medicine, I did a research project on menstruation. It's always been an area of interest, working in female health or women's health. And it is a phenomenon that does not affect certain cultures. And so the more modern cultures tend to suffer with PMS symptoms more strongly than cultures that are living closer to the earth or without as much processed food or maybe without as much external stressors or influences. So I think it is just a symptom itself, part of our more modern lifestyle. As girls mature into what we call menarche, or the beginning of menstruation, a lot of the influences can also come from the psychological influences of what media or family have told them to expect. It's going to be a painful, difficult time. And so that can also be part and parcel to their puberty experience. I think in general, we know if we're interested in nutrition and supplements and herbs, we know that many of us are living with a higher degree of inflammation. And with inflammation comes more pain. And oftentimes inflammation also affects our mental capacities. So if we're having moods that fluctuate in response to the hormone fluctuation, it can come from that inflammatory link as well.
So ways to mitigate that inflammation?
Yeah, the pillars: good sleep, self-care in terms of mindfulness, eating well. And then there are a lot of supplements that are available that can help ease inflammation. The classic ones that we know of are kind of culinary herbs like ginger and turmeric, the herbs that you find in a chai tea, for example. And then we can focus on helping to support the hormone production from an ovarian level. One herb that we love in herbal medicine is chaste tree berry because it helps to support the ovaries' production of progesterone predominantly, but can also influence estrogen and testosterone health at any stage of a woman's menstrual life.
So, Dr. Blossom, you talked about processed foods or our diet. So, if you know young ladies or older women too, and just before your period comes, we're craving chocolate or we're craving the carbs or we're craving something that
Salt.
is not helpful. So, what do you say about that? What do we do in regards to, these cravings and they just
Right.
overtake us?
So, a lot of times we can look at what we're craving as an indication of what organ or mineral needs support. So, you use the example of chocolate. Oftentimes, chocolate craving is an indication of magnesium deficiency. And so, if we supplement with magnesium or if we choose other foods that are very high in magnesium, sometimes those chocolate cravings will go away. If the chocolate cravings are rooted in emotional life and chocolate was always a comfort food, all the magnesium in the world may not touch that. Yeah.
Yeah, yeah. But would you
Yeah.
say cramp bark would help with the cravings, or that just helps for the
Um,
inflammation?
Cranberry is anti-inflammatory and it's also antispasmodic. So it would be more of a bringing down the inflammation and bringing down the actual cramping. So a lot of young women or women of any age will experience really debilitating pain at the time of their period, cramping in their, lower abdomen or uterine area, but it can also radiate into the back and down the legs. Cranberry is a really, really effective herb at helping with the more physical symptoms of what it's named after. Yeah.
Okay, so how long would you say someone should take cramp bark?
So cranberry would be like just a swap for when you would reach for the over-the-counter solutions that probably
Okay.
most of the people have experienced. So they're NSAIDs, they're COX-2 inhibitor type over-the-counter painkillers. The minute they start feeling the pain, or if they always know that the day before their period is going to be really painful, and they know that it's the day before their period, they could even start taking it that day to help bring down the inflammation and relax the muscles before the pain even started.
So what
Yeah.
about like Chase Tree Vitex? I tend to recommend that a lot. Would that alleviate some of that PMS?
Yeah, yeah. So that one is more it really works on balancing the relationship or communication pathways between the brain and the ovaries.
Mm,
So that's where I would go for more of the craving or the mood swings. A lot of times women will experience a dip in their mood, not just the irritability, but also sadness or depression. If it's that PMDD, which is the severe depression, then there's probably going to have to be more mood support than just chaste tree on its
okay.
own. But chaste tree is a great single herb to help mitigate that PMS. And that I would start to dose earlier in the cycle, not just when it starts.
Okay.
So a lot of times I have women taking chaste tree all month long because it's a great regulator. So if the period or the cycle isn't regular and predictable, I have them take it all month long. But if they're just like, I have cravings or I have mood swings 3 days before my period, then I would usually start it maybe 3 to 4 days before they usually have the onset of symptoms. So everything with herbal medicine and naturopathic medicine, you ask a timeline and it's kind of like, well, it depends.
Yeah.
But it is one that I tend to like to use as a regulator. So I'll dose it all month long, but it does depend on what you're specifically trying to target.
Mhm.
Yeah.
Well, I get women doing the Vitex, and like for me personally, I did it for 2 years. And going into like perimenopause and menopause, I really had hardly any symptoms. And I mean, I dealt with other things later, but yeah, so I try to encourage women like balance your hormones. And I think Chase Tree or Vitex is a good place to start if they don't
It
know.
is
Would you
what
agree?
we Yeah. We refer to it as the hormone normalizer, the hormone balancer. There's a couple of caveats with chaste tree is that you don't need much of it. It's a nice
Okay.
herb that can be taken ongoing at a fairly moderate dose, but it does require patience. So
Mm.
a lot of times you really have to be on it. If you're still cycling, you really have to be on it for 3 cycles or 3 months to
Okay.
see what you're going to get from that herb or what benefit you're going to experience.
Okay, good to
Yeah.
know. Good to know.
Yeah.
So, as I said about going into perimenopause, cycle irregularities, some women, it might be thyroid health. So, how do we ease the pain of that transition? Because we're all going to go through it.
We do have many herbal formulas that can help address those types of symptomology. And depending on where in that reproductive life cycle we're trying to focus, if we're talking about perimenopause, I like to have that chase tree as part of the formula. For example, St. Francis Herb Farm has a formula called Menopause Support, and it really should include that peri in brackets in someone's mind because it really is helpful for those final years of menstruation to help as much as possible keep ovarian production optimized with progesterone. But then there is a complement of many other herbs with the chaste tree berry that help with some of the symptoms of perimenopause. So helping with painful periods or with migraines or with hot flushes and night sweats or palpitations or that feeling of their brain being hijacked. I hear that a lot. It's like I'm just not myself cognitively or mentally. And a lot of times, as our hormones transition, that becomes our experience more so than the moodiness or the ups and downs of the reproductive years. We start to notice that I'm just not recalling things like I used to
Mhm.
closer to the menopausal time.
Yeah, I'm glad you brought that up because that's sort of my topic of interest is brain health, brain fog, cloudy thinking. So my mom comes from a family of 11. 7 of them were girls, and of those 7, 5 have suffered with some form of dementia. They've all since passed, including my
Right.
mom. So for myself, I'm always looking at ways to improve my brain health.
Right.
And sometimes it's stress, you're exhausted, your
Right.
energy, that sort of thing. But I'm past the menopause. And yeah, so, there's more research now on postmenopausal women and brain health, but it
Right.
feels like a lot of the research is on the women parts and not
Yeah.
so
Yeah.
much on the brain. So,
And
your
how they
thoughts, please,
interact.
because yeah, once you get past menopause and you still have that brain fog or cloudy thinking, thoughts on that, like what's going on?
So there is fairly recent research or resurgence in research in the optimization of how estrogen plays into the optimization of brain health. And so there is a current movement that I really see or hear a lot about, supplementing estrogen earlier to prevent a decline in brain health. And I'm not opposed to that concept. But if people are looking for, okay, how could we parlay that into herbal medicine or supplemental medicine? We look at some of the herbs that have that phytoestrogen quality. So it's like a plant estrogen that can also support brain health throughout the ages. So one that I think of because of the way it's been named, because it's been recognized for so long that it helps support brain health, is sage.
Mm.
So we know that
Yes. Yeah.
sage is named because it helps with cognitive health. So we do include that in our menopause formula. But if someone was really concerned about specifically cognitive health, they may want to take singles out of that formula. Sage or rhodiola is another one that the more we learn about how it interacts with estrogen receptors, we see it protecting brain health. We see it protecting bone health. We see it protecting cardiovascular health in similar ways that the estrogen therapy is now being found to do, but in a, hormone replacement free way. But if someone has chosen to avoid estrogen replacement or has been medically suggested that it wouldn't be beneficial to them, there are these herbs that can be very, very helpful in those areas. Even for someone who is choosing to do hormone replacement therapy, there's no reason why you can't complement the effects with hormones.
And it depends on the estrogen too, right? Like
Right.
the estrone, estrol, and like
Yeah.
the
And your
levels.
genetic
Yeah,
predisposition
yeah,
to being
yeah,
able to break that down into healthy
yeah.
estrogens that are
Yes.
useful, or whether you're genetically kind of programmed to not benefit from having all
Mhm,
this excess or abundant of
mhm.
estrogen in the body.
Okay. Yeah, I speak at a women's group. It's a breast cancer survivor, whatever point they are at. And they're all afraid of estrogen. And it's not for me to say what they should or shouldn't do, but going back to my mom, like none of them had estrogen. Like my mom has a hysterectomy and she was never estrogen
Right.
and bone health and so on.
That is, I do think that that is starting to change.
Mm,
And the breast cancer piece for those with estrogen receptor positive family history or personal history, I think it is still, we're just getting to having enough knowledge around that.
mhm.
But phytoestrogens, again, have been shown to be protective and not harmful.
So,
Whereas when I started practicing, it was like, don't touch flax seeds if you have a family
mhm,
history of breast cancer.
yeah,
We now know that flax seeds can be beneficial for those
yeah.
people.
I
So,
was just
yeah.
going to say, would you recommend sage for that?
Yeah, the caveat with sage is that it isn't, in my mind, it isn't always like a long-term
Okay.
herb.
Okay.
So it's more of a moment in time. So for them, it would be more like, I think I would do more like a rhodiola,
Okay.
which is a longer term
Okay.
sage for a period of time for sure, but maybe
Okay.
not for the next 2 to 3 decades.
And rhodiola also helps for anxiety
Yeah, it's a
and
great
energy.
adaptogen. It supports the adrenal glands. We now know it has these
Perfect.
supportive roles with the
Yes.
perimenopause and menopause time. And it is one of my favorite herbs. I'll just close that right now. I get
Yeah.
so enthusiastic about it. But it also, in its adaptogenic function, helps support dopamine and serotonin. So it acts in this similar way that an antidepressant would. And a lot of times, let's say 10 years ago, most women during perimenopause were put on antidepressants. That was the
Yeah.
solution for the withdrawal of
Yes.
the
Oh, I know.
progesterone.
I
It's like,
know.
okay, everyone needs antidepressants, whereas it was probably they needed support for their estrogen and progesterone specifically. Now I'm finding, and I'm not criticizing, it's just kind of like a medical trend. A lot of those women who would have been prescribed antidepressants 10 years ago are now being prescribed stimulants.
Mm.
So there is a lot more awareness around ADHD and
Oh my
productivity and
goodness.
how
Yeah.
those meds can be helpful. But sometimes I think that scattered, it may be partially a lifetime of ADHD, but
Hmm.
probably also very accentuated by the hormone disruption.
Yeah. Yeah.
Yeah.
And then flip side to the antidepressant, they start putting on weight and they feel even more depressed,
Right.
because they
Right.
can't
Yeah.
lose the weight.
Yeah.
Wow, that was really informative. Thank you. Thank you. And now I'm going to be telling everyone to take rhodiola that comes in and because
Well, I mean, it doesn't fit for everyone. I'll say check for
yeah,
sure.
yeah.
Anyone who's had bipolar or manic episode, there is a
Mhm,
contraindication there because it does increase that dopamine
mhm.
production. But it is in that menopause support formula as well. It's not one
Yes.
of the main herbs. It's actually the least in quantity, but it is there. And like I said, it is one that I'd be comfortable to do in a formula and as a single in addition to that. Yeah.
Nice,
Yeah.
nice.
Yeah.
So here's another, and it'll be my last point for you. I've got women like 50, 60-year olds coming in with reoccurring urinary tract infections. And, they're trying everything to get relief. They go on antibiotics, create a vicious cycle, UTI comes back, antibiotic. And so are you seeing this in your practice as well?
Yeah. A lot of times, and you may have just said this, but a lot of times I see that like post-menopause,
Hmm.
like 10 to 12 years after the cycles have stopped, or even women in their 80s,
Hmm.
coming in and having these recurrent bladder or urinary tract infections that just don't seem to go away. So there's a few influences there, I think, that are relevant. One is that after menopause, along with the vaginal tissue becoming less strong and the integrity of
Hmm.
the vaginal wall can deteriorate, as can the urethra. So the tube that carries urine from the bladder to the outside world, because that tissue is so closely located to the bladder, it responds to hormones as well. And after menopause, it can lose some of its integrity. And a lot of times we get incomplete emptying of bladder as part of prolapse and the deterioration of the vaginal components. So I do see that. I see that. And then I think there's also oftentimes what we refer to as interstitial cystitis,
Hmm.
where it looks like an urinary tract infection. It may present even clinically with a culture with a urinary tract infection, but it doesn't clear because there's also all this inflammation that the antibiotics don't necessarily address. So again, at St. Francis Herb Farm, we have an herbal formula that we call UTI Clear that really helps to move the infection, but it also helps to bring down inflammation in the area. So it's not doing anything for that first piece, the hormonal piece, which would have to be addressed separately, but it can really help with if a woman knows that she's starting to have the symptoms of a urinary tract infection, she's got those signs, or she's engaged in a behavior that she knows will oftentimes trigger a urinary tract infection. A lot of times that can be from long distance relationships where there's a lot of sexual activity in a person who isn't as accustomed to sexual activity. Or even I've had patients say, like, every time I go swimming in the ocean, I end up getting urinary tract infection. So it's different for different people. But the herbs in our formula, the UTI Clear, not only help to move the infection, so there's some diuretics, fight the infection. So there's herbs that are antimicrobial or antibacterial. There's also some herbs in there that help bring down inflammation and soothe the bladder wall and the urethra. So they all work together to help prevent an infection from really blooming, or help with the recovery after a course of antibiotics. Or where I really like the formula is to use it as soon as you think one might be coming on, and it can help prevent it from occurring.
That's amazing. Yeah, I recommend that product a lot, UTI Clear. And I get a really positive feedback on
Mhm.
that product. So
Yeah.
I recommend that one quite a bit.
Another
Yeah.
one that may be helpful in conjunction with that, if there is some of that hormone withdrawal, like the atrophy,
Okay.
would be the Calagel, which is the vaginal moisturizer.
Ah,
So it's a
okay.
herbal moisturizer that doesn't have hormone, but it can also help with that vaginal dryness or loss of integrity
Lubrication.
in the vaginal lubrication.
Okay.
Yeah,
Okay.
yeah. So they
Okay.
could be beneficial together in
Yeah.
those
Can you
types of
say it again?
cases.
Cali gel? Cali
Calagel.
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 Okay.
Like,
All
so it
right.
has calendula in it, which is an
Hmm.
anti-inflammatory soothing herb. So that's where that
Okay.
cala
Okay.
prefix. It is going to be renamed Women's Comfort,
Okay. That's what I was wondering.
or Herbal
Yeah.
Comfort. And we're adding hyaluronic acid to the formula, but
Oh,
that won't be available until like probably summer of 2025 with the
okay.
reformulation. So
Okay.
the
Yeah.
Calagel is currently, yeah,
Yeah.
yeah.
Wow. This was so informative. Like, I could talk to you all morning, but I know you have other things to do, like look after patients. But where can people find you in Moncton, New Brunswick, or
Yeah,
St. Francis? Like, I will have all the information in our show notes as well,
right.
but
Yeah.
where can people find you today?
Yeah. So probably the best touch point for St. Francis is their website at
Hmm.
stfrancisherbfarm.com. And for me, I love Instagram. So Blossom Naturopathic Clinic on Instagram.
Okay, I'm
So
going to
it's probably
find
the
you.
easiest way to find me.
Well, thank you for your time. This has been wonderful. Great, great information. And so people go to St. Francis Herb Farm website. You can get more detail into the products that we spoke about, or if you want to touch base with Dr. Blossom, if you're in her area, follow her on Instagram, or just come into the store. And if you're in my area, in the Hamilton area, we'll be happy to answer your questions there as well. So again, thank you, Dr. Blossom. This is wonderful.
Great.
And
Thanks for having me.
you're
Yeah.
welcome, and have a great day.